Okay, great, thanks. I'm just going to provide a little bit more detail. Oh, did you want to? Sorry.
Sorry about that. So we usually just give it a second for the delay. So yeah, I'll hand it over to you, Hsiu-Li. Just want to welcome everyone. It's Tuesday, October 20th. As you know, we had a Board of Health meeting this morning. So Dr. Wang's just going to provide a little bit of context to one of the things she updated us on this morning. I do have a little bit of an enforcement update as well, and then we'll get to your questions. So I'll turn it over to you, Dr. Wang.
Yes, I'm just going to provide a little bit more detail about the dashboard change. So we will move our dashboard update from 10:30 a.m. daily to 1:30 p.m. daily starting tomorrow. So as I mentioned, this is because with the new system that we're on, cases come in at all hours of the day and night. And so, as you've probably noticed, it is difficult for all of us to keep up with how many cases happen in a day, because we have been to date reporting up to 5 p.m. and then we have to add cases from that come in after 5 p.m. to the next day's total, and it becomes a little bit confusing. And so now we are going to be reporting from midnight to midnight. And in addition, because cases or outbreaks in workplace, school, childcare, and long-term care, retirement home settings can be declared outside of operational hours, moving this update to 1:30 will allow us more time to ensure that the affected individuals and institutions are notified before it becomes public, as they would be the most important persons to be aware of first, to be aware of the information first. And so this change overall, our objective with this change is to make the reporting more timely, and also help clarify our daily totals and to help minimize cases being added to previously reported totals. That said, there will be times when case data may have to be adjusted just due to ongoing follow-up and case management, as well as the transfer of cases between jurisdictions. And that, the data is, more recent data especially, is always subject to change, especially for cases or outbreaks that are still under investigation. So, but hopefully it will reduce some of the more frequent updating of previous days' numbers. Okay, so I just wanted to provide those additional details about the reporting change going forward. Okay, and so provided an update to the board this morning, and wanted to see if there were any questions that you would like to ask me in relation to
So I can take it back over for you, and I'll do the enforcement update first, and then we'll go to questions. So so we do have one enforcement update to provide to you, where City of Waterloo bylaw issued a charge, was failed to comply with the order based on gathering limits being exceeded at a private residence. So there was a ticket issued to the occupant responsible for hosting the gathering, and it was the $750 plus surcharges. Other than that, we continued to respond to complaints for a variety of issues, whether it's the masking bylaw or other issues regarding the orders. So overall, the only charge this week was the one that I just mentioned. Otherwise, it's just follow-up education and no further response needed. So that's it for the enforcement update. And now we'll go over to all of you for questions, and we can start with Kate from CBC. Go ahead, Kate.
Hi, Kate.
Hi, good morning. Sorry, my dog is barking. My apologies.
It's okay. My phone was
during your Board of Health update, you were talking in particular about sports leagues, and I'm wondering if any of the minor sports leagues have been in touch with public health to sort of get guidance, or if they're just sort of relying on what the province has provided.
It's possible they have been reaching out. There's a team we have in public health that response to questions from various settings. You know, I wouldn't be able to tell you exactly how many who reached out, but you know, we really the key point I was trying to make is, you know, there are these guidelines for such settings, but there is also a trend that we're seeing provincially as well as locally, where there isn't always consistent adherence to the guidance, including, you know, outside of the games proper, when people are gathering socially afterwards. And so really just wanted to pass the message that there are these at-risk situations that we're sort of seeing happen across the province and locally. And we want people to understand that we can't let up our guard in those types of situations.
Yeah, and I guess that was one of my questions as well, is just if you had a message for those people who are taking part in sports, and in particular, like the socializing afterwards. Maybe they're having beers after their hockey league or something like that.
Yeah, exactly. So, you know, so we've seen actually in other jurisdictions already outbreaks in such settings. And here we haven't seen an outbreak yet, but we've seen at-risk situations because, you know, we've had cases and then there have been a number of people on their team or among their friends who've had to isolate after, because when you ask them, and we appreciate them being honest with us, because that's the only way we're going to really be able to, you know, keep things from spreading. But when they're honest with us and they tell us, well, yeah, you know, we sort of just hung out. And were you physically distant with each other? No. Did you wear masks? No. So, you know, and in those situations, there continues to be a greater risk. I think in overall, in general, there's always that difficulty where, you know, you see at-risk situations and then you tell people about them, and they're, you know, they want to be careful and they want to follow the rules. But then they see, you know, cases are not really climbing, you know, things are kind of calm here. And then they sort of think, oh, it's probably okay. And they relax a bit more with the precautions. So there's, you know, there's that can naturally happen. I think people really want to do the right thing overall, but that can happen. And so really my messaging is, you know, in those settings, this is the trend that we've been seeing in our case and contact follow-up. So
we'll just see if she unfreezes.
we
Okay, here we go.
have to keep this up at all situations where we see outbreaks in these fitness. We have to, a lot of what people can do themselves and, you know, help their teammates do. So, you know, in a setting, hey, guys, gals, you know, let's just continue to stay distant from each other. Let's continue to wear masks whenever we can, you know, and just try to reduce the risk for the whole team.
It kind of reminds me of what you were saying last week about the businesses, that they do so much right up front, but then they're lax in the back. They're lax, like in the back. Yeah, because they're just like, they forget. It's like, oh yeah, oops. And it's the forgetting part. It's like 7 months in. Are you surprised people still forget to do this?
Well, I think people, you know, they hear things like things have, you know, gone down in the summer and things were quieter, and even, you know, they're seeing things happen in Toronto and Ottawa and Peel and now York, but they're saying, oh, it's not so bad in Waterloo. So I think it's a human tendency that we all have. When we start to see things get better, we think, oh, you know, we probably don't need to, you know, do as much. And also, you know, we have businesses opened and they're trying to keep open, right? And so people can think that it's all right. And what we've seen happen is, whoa, in some areas in the province in particular, things have really escalated really quickly. And so we really have to get back to the basics And we have to remember, even though, all these settings are opened, there are, guidelines associated with them. And individually, we have a lot to do with our case rates, because we've seen so far a lot of the issues that we've had across Ontario and even here have to do with when people are socializing outside of settings where there are requirements and everybody has to maintain a certain distance. When they're with their friends and family, maybe they feel more comfortable and less at risk because they know the people. But in those settings, we start to get cases and clusters of cases, in these social and private settings. And when we ask them, were you distant? Were you masking? The answer often is no. We thought it was okay. And so, and you know what, though, I find that, I'm trying to emphasize these things that we're seeing, so people know what are some of the common things that we should be watching out for. But I also have to say, Waterloo hasn't continued to accelerate at this time, Waterloo region, right? And so that's a really good sign. And that just tells me that people are listening. And like I said before, by and large, people want to do the right thing.
Great. Thank you very much.
Thanks, Kate. We'll move on to Joanna from the Record. Go ahead, Joanna.
Hi,
Thank
Joanna.
you. Just following on what you just said, and just talking earlier about keeping close contact to immediate household members. Are you concerned as we head into winter and more people are going to be indoors? Because I know you've said too, it's best to gather outside.
Yeah.
Are you concerned that you're going to see more of these gatherings where people let their guard down, plus they're also inside where the risk is greater?
Yeah, no, that's a great question, Joanna, because it's true. As the weather gets colder and more people congregate, there's going to be more situations where more people are going to be congregating indoors. So we're asking people to sort of think of, well, if they want to do activities, especially activities where they have to take off their masks because they're strenuously exercising and they can't wear the masks when they're doing that. Think about ways you can continue physical activity more outdoors than indoors. And even if you are doing things indoors, try to do things with smaller groups of people. So those are kind of the general principles. And you're right, as the weather gets colder, people are going to congregate more indoors, and there's going to necessarily be a higher risk level overall, unless people really maintain those precautions. And also, if you're indoors, ensure you have very good ventilation, and try to bring in fresh air, and try to make sure that the air isn't constantly recirculated, but rather that it's expelled and that fresh air comes in.
And just generally, what are the challenges you're worried about in the second wave? Sort of things that we didn't have to deal with the first time around.
Yeah, no, thanks for that question. I think sometimes what people don't necessarily understand until they're involved because they're a case or someone they know becomes a case is that, as we try to, again, keep our community as open as possible, we're going to have more contacts with more people. And so, what happens is that it becomes, there's a lot more people in order to, that we have to follow up with each case. And there's a lot more settings that we generally have to follow up with. And so if everyone sort of makes sure that, whether it's, with their work colleagues or with their members of their family outside their immediate household or it's with their friends, if in all of these settings that they're with others, unless it's with their immediate household, they keep a distance from other people, and they wear masks whenever it's required, or whenever distancing can't be maintained, then that will just reduce the risk overall. Sometimes I think people are surprised, and we follow up a case and we have, a few dozen contacts to follow up with. And that's because of, all the interactions that people necessarily have. But when people have been practicing good measures, we also notice that there's not further spread than in those other settings, which is great. And so it's a general kind of, I think, messaging, which will become even more important as people become more likely to gather indoors, is to keep up those measures in every setting. And hopefully over time it becomes more of just an instinct, and people don't feel awkward to say, hey, let's keep our distance. Because sometimes with friends or colleagues, someone's coming up to you and they're really getting close, you feel like, I don't want to be rude. but no, let's help each other. Let's just remind each other, hey, it's best if we stay apart. So let's just keep our distance, and remind our friends and our colleagues about that, because I think just sometimes we're very social beings, right? And sometimes just especially when you're familiar with people, you kind of forget that. And so I think all of us can play a role, and help our friends and colleagues also remember, everywhere we go, we should physically distance, and we should wear our masks as much as we can.
Yeah, just getting over that sort of hesitancy to be, that person who's like, could you please back up or put your mask on?
Exactly. It's so natural, right? It's so human to feel awkward if you're the only one saying something. And so, I guess what we're trying to do is change that social norm, and just, let everyone know everything that we each do individually in our settings, including, being the one to speak up and say, hey, let's protect each other by staying distant, that's actually going to help our community overall. Because the more of us that are going to say something when our friends and colleagues inadvertently get too close, the more we're going to be able to protect each other, and as we're seeing, stabilize infection rates and prevent it from continuing to spread.
All right, thank you.
Thanks, Joanna. We'll move on to Casey from 570. Go ahead, Casey.
Hi, Casey.
Hi, I'm actually okay. Thanks.
Okay, Nicole, over to you. Nicole from CTV.
Hi, I just want to back up and ask in regards to the ticket that was issued. Was it issued over the weekend? Are you able to provide how many people were at the gathering? And why only $750 if hosting an event comes with a fine of $10,000?
I won't be able to answer all of that, Nicole, so we might have to do follow-up, but it was issued on October 10th. So I'm not sure. Someone have a calendar? I think that was the weekend.
It was issued by the city. So I think the city of Waterloo would have more specifics about that particular ticket.
Okay. My follow-up has to do with positivity rates, which provincially, it appears to be a bit of a concern today, because out of 24,000 tests, 821 people tested positive, and that's a positivity rate of 3.4%. Is that a concern for you and, our positivity rate here in the region?
Yeah, no, that's a great question. So I'll start with the province. So yes, so overall, the province's overall positivity rate is, I think the 7-day average is still something like 2.5, maybe a little more now. But there are days when we're above 3 provincially. Yeah, and that is concerning, because generally when you get above 2.5 or 3, that's a significant rate of infection, even though it doesn't seem like it from a numerical standpoint. But experts who are experts in this field tell us that once you start to get past 2.5, 3%, you're looking at a significant rate of infection in the community. So here in Waterloo region, what we've noticed is we had low rates of positivity, 0.5 or lower during the summer when we didn't, we were outside of any wave. And then starting, the beginning of September, like everywhere else, sort of, we started to climb in our positivity rate. So we went from 0.5 in the beginning of September to around 1.2 or between 1 and 1.2 percent of our tests coming back positive. And I've been taking a look at our positivity last couple of weeks, and it's remained within the 1 to 1.2%, mostly 1.1. So, that's good. So basically that's another indication that similar to how our rates have not accelerated in terms of their evolution. They started off going up like this, and then they've, became more like this. Our positivity is also saying the same thing. It's saying that, we have not accelerated in our cases, and we're sort of staying at that 1 to 1.2 or 1 to 1.1 or 1 to 1.2 percentage. So what we have to watch for going forward is to see if that remains stable or if we are continuing to climb like some other areas. That's what's going to be important. It's one indicator, not the only thing, right? Just like case numbers are not the only thing, but it's part of an overall picture that tells us that currently we are not accelerating in the region, and that's really largely due to the actions that residents in our region have taken. They have really taken this seriously.
Given now that we're more than a week away from Thanksgiving, if people gathered, would we have seen the case count go up by now?
Yeah, we will. We should be starting to see it go up now, and in the coming week or so. So we'll have to see. We'll be watching carefully.
Yeah. So Councillor Foxton brought up something very interesting, saying North Dumfries Air residents have a tough time taking public health measures seriously because they do not have any cases. What's your recommendation? Because we've seen other municipalities have something similar and then, cases show up.
Yeah, so I think, this I think the first thing I would say is this virus doesn't really discriminate between municipalities. It will go wherever there is a chance for it to spread. And yes, we have seen overall that areas in the province where there's more people overall, like the density of the population is greater, will tend to have greater rates. But the ability to spread is the same across the province. And secondly, as we've seen, there are areas like elsewhere in our own region where rates have been really low, but then there have been a few cases, and then the case numbers can increase. So everyone is, everyone is at risk for potentially getting and spreading COVID. And the other thing to remember is this is where people live. This is where cases live. It doesn't necessarily translate to where they could be getting the infection or could have, or because these are about cases where they got the infection. So your risk depends on your interactions with people in various settings, not just where you live.
Can I ask one last question?
Sure.
There appears to be fewer cases and outbreaks in school settings. Would you say the protocols in place by the province are working for areas like Waterloo region?
Yeah, I would say, well, I don't know if there's less. I think it fluctuates. It tends to fluctuate with our community rates. that this is a trend we're seeing now across the province. When community rates go up, school outbreaks go up, long-term care home outbreaks go up, workplace outbreaks go up. And so because our rates have been stable the last few weeks, we haven't really seen any increases in the rate of cases and outbreaks in schools. But I would say overall, the protocols that have been recommended for the schools are very conservative protocols. And what we've seen to date is that they work well. They are disruptive, right? It's important to acknowledge, it isn't necessarily easy for parents when suddenly their child is in the class, it has to be dismissed. But overall, they've been conservative and they've worked well. And so we haven't seen in our region signs that there are increasing rates of infection or outbreaks in schools. We haven't seen more than we would expect to see just with our general rates of transmission in the community. So yeah, I think so far they are working well.
That's it for
Okay.
now.
All right. So we've gone through the group once. Are there any follow-up questions?
Hi, Kate.
Okay.
I
Go
knew you were
ahead.
going to.
Hello.
Okay, what we're here for.
During Board of Health, I believe it was Mayor Shantz was asking about Halloween and
Yeah.
tell council later, and you had said things probably aren't going to change between now and next week. Oh my gosh, it's next week.
I know.
But,
That's why I said that.
I know. And you had suggested she take a look at the province's guidelines, but we've had a few questions where people are asking more pointed things beyond wearing a face covering and don't linger at doorsteps and stuff like that. Like, do people need to be quarantining their candy ahead of time? Is there there's more of that specific, do we need to do something with the candy to make sure it's extra safe or something like that?
No, with the candy, nothing different except, you want to avoid children getting candy out of a common bowl. You want basically, the principle is you want to avoid multiple people touching the same thing. So, I've heard of very ingenious methods that have been thought of elsewhere, like a candy chute, right? Building a chute from their doorstep down to anyway. So or if you don't have a chute, right? Just make sure that if you're handing out candy, in addition to wearing a mask, you sort of hand it out with some tongs. Or I know Dr. Tam has even advised, since we're in Canada, you can use a hockey stick. So basically, it's whatever helps to ensure distancing and to ensure that candy isn't touched by multiple people. And the other thing that I've heard is sometimes households will leave out candy in, like individual packages. And so people can just pick up one package and go. And that's another way that, people can make it safer. So it's really those principles where you're trying to avoid multiple people touching the same thing, and you're trying to ensure distancing for the kids and the parents. So so that's what I would advise. Yeah.
And if I could just add, Dr. Wang says this a lot as well, is hand washing. So,
yeah. Sorry.
If you bring, that's okay, we're a team. Bringing along the hand sanitizer, having it, if you are handing out candy, frequent hand washing is very important. So do you have any other questions, Kate? No, okay, so any other questions from the group? I see Nicole's hand up. All right, go ahead, Nicole.
Yes.
This is more about the flu shot this year. Are you able to provide an update and more details about the upcoming drive-through flu clinics planned?
Yeah, so actually there is an update, a report going forward to the regular committee meeting next Tuesday that will provide an overview of the plans being done in our region. Plans that have been made for our region. There's a lot of partners that are participating in in helping our community be better prepared for flu. So there are family doctors, our long-term care homes, retirement homes, our pharmacies, and we also, public health also plays a part. We distribute vaccine to long-term care homes and retirement homes and primary care practices. We don't distribute the vaccine to the pharmacies. That goes directly from the province to the pharmacies. But overall, there's multiple people that are playing a role, and what we've seen so far is a really great demand for the flu vaccine, to the point that we've heard provincially as well as here, people are saying there's not enough flu vaccine where they're trying to get it, and we have asked the province about that, and they have indicated that overall they've ordered more vaccine, and that the supplies are coming as we speak. In every year, there's never like all the supplies available at once, right? Usually they start with getting as much as they get from the manufacturer out, and then getting more as they get more from the manufacturer out. And with the first supplies, they are tailored or they are prioritized more to the at-risk settings. So, with the shipments we've gotten for the region, which is proportional to what we've given in the past in our population, we have really prioritized those settings like long-term care homes and retirement homes, and and for family doctors, we've recommended they immunize their more vulnerable clients first. But we know there's still demand, and so that vaccine, there's more vaccine coming from the province. It will be coming in the next few weeks. So hopefully everyone's going to be able to get what they would like to have, but it won't be right away, everybody. It will be over the next few weeks.
Okay, great. Any other questions from the group? Okay, I'm not seeing any hands up, so we can conclude today's media briefing, and we will be back on Friday, October 23rd at 11:30. So we'll see you all then, and thanks for joining us today. Take care.
Thank you. Have a great day.